Hello, everyone, and welcome to today's Academy. I'm super happy and excited to see people again here gathering to listen to us. And as always, we are bringing in the top experts, keynote speaker, and I'm super happy to welcome today Darin Detwiler. How are you, Darin?
Great. Thank you for having me. How are you doing?
Good, and I'm super happy that you joined us again, like this year. So last year we did a kind of closing remark of 2024, and this year we are in the middle, so there are a lot of hot things to discuss today. Yeah, and before we continue, as always, I ask you guys, please let us know that you hear us well, see us well. As always, I'm looking forward to see magic reaction sign, which is on the left bottom corner. Just press some hearts, claps, perfect. So people are ready to start. And as always, just a huge thanks to Nemis Technologies for allowing us to exist, our small educational project, Nemis Academy. And yeah, I will not just take more time from Darin. Darin, time and stage is yours.
Well, thank you very much. So, deep beneath the ocean surface in a nuclear submarine, I spent years surrounded by various risks and threats, whether it was the pressure of the ocean, especially at greater depths, the presence of any enemy submarines. But one that I wish to talk a little bit more about here as I start to kind of start with an analogy is the idea of radiation. I was a nuclear engineer on a submarine long before I was ever working in food safety. And as an engineering supervisor, I was also a nuclear reactor inspector, quality assurance inspector. And as one can imagine, one of the things that we did a great deal was monitoring our radiation exposure. There were three devices that we would use. One, pictured on the left, it was a device where we could clip it to our shirt and we could literally read it in real time. In fact, I included a little image of what that would look like in there. It wasn't the most accurate, but it was pretty accurate. It was close, but it was very real time. On the left was a device that actually opened up and created two different dosimeters. One, you see there kind of in the middle, looks like a little glass tube with a wire on both ends, was extremely accurate, but required it to be taken out of the casing and put into a piece of equipment for reading. So it could be read within 5-10 minutes after I exited the reactor compartment, but it was extremely accurate and collected all data. In the bottom there, in the cap for that device, was another dosimeter device, but this was for high level radiation exposure, catastrophic exposure. This was pretty much only going to be used after it was too late to do anything. I couldn't be impacted positively by the reading of this. If it had to be read, I was already harmed, if you will. So to recap, one provided real time data collection. One was very accurate, but somewhat delayed. And one was purely reactive way of looking at data. So I want to use this as a frame for talking about this idea of from farm to hospital, the real impact of food safety. And if you don't know who I am, I'm Dr. Darin Detwiler. I'm the founder and CEO of Detwiler Consulting Group. I'm also an associate teaching professor, full-time professor at Northeastern University, and adjunct professor at Michigan State University's College of School of Law. I'm the author of various books, and I was recently seen in the documentary, the Emmy Award-winning documentary, Poisoned on Netflix. Maybe you've seen it. I highly recommend it, and that's where you can learn about not only some of the realities of food safety today and how they have changed over the last 3 decades, but how I became involved in food safety. And I will be able to touch on that a little bit later today. So, getting back to the idea of monitoring things, right? Real time data, right? Providing real time and proactive look at data is this is essentially leading with intention. The idea of always keeping your eye out from a variety of sources. And if we look at the idea of accurate, we must include that, or we must conclude that accuracy is not only about precision, but completeness in all data. But then we also can look at the idea of that reactive. So it is important to have this reactive data, but taking action only after irreversible harm has taken place is costly, it damages reputation, and it's unethical. If you look at the idea of a company being able to rebound, but consumers and families not being able to rebound, that is a significant consideration. And quite honestly, it's something that I have seen throughout over 3 decades of working in food safety. There are too many companies that seemingly don't react, they don't change what they're doing, they don't withdraw items, they don't change their SOPs, they don't change, policy, whatever it is, until after major catastrophic harm has made the headlines. And so, why is that? Especially when you look at the fact that most of the cases that I have looked at or been involved in, if you look at how they reacted upon those headlines, those food safety red flags, there were always earlier indications, there were always earlier signs. And of late, my argument is that if we look for ESG, the environmental sustainable governance type of uh, environmental social governance type of red flags, you will find ESG red flags before you will find food safety red flags. But you have to look for those. You have to be collecting that data. You have to be acting upon that data. So again, we need to look at this bigger picture, and this is what we're going to be looking at here today. Ultimately, we need leaders who understand and use all three levels of data collection and analysis for making decisions. Without all three types of data, leaders are flying blind and families ultimately pay the price. Before I go on any further, if you have any questions, please feel free to type those in the chat. We will have a Q&A at the end of this, and I'll try to get back to them and those questions, and have some opportunity for asking questions to dig deeper on some of the things I bring up, or to ask about other topics that are pertinent or tied to the conversation this morning. And it's really cool. I saw a list of I saw a table, I guess, of the people who are joining us. So many people from different companies. Do me a favor and please, in the chat, say hi. Tell me, what country you're from, what city you're from, or what is your job within food safety. It's amazing how many people can do pretty much the same thing but have incredibly different job titles. It's always kind of cool to see who's doing what. So, you don't have to tell me what company you work for if you don't want to, but it'd be great to get a sense of where everyone's from. All right, well, let me get back into the presentation here. Some obvious facts that we might know here. In the United States, the Center for Disease Control has long held their estimates of food safety at 48 million Americans get ill, 128,000 are hospitalized, some 3,000 die from failures in food safety every single year. And if we look at the global statistics, the World Health Organization, they hold that an estimated 600 million people in the world fall ill after eating contaminated food, and some 420,000 die every year. These are staggering numbers, and it's important for us to put this into perspective. And I want to say this in a different way. When we look at our procedures and our actions and the decisions we make within the food industry, we have to take into consideration likelihood and severity. And I've been in situations where far too many times the likelihood and severity models are very conservative. And by conservative, I mean they don't really reflect the reality out there. We have to look at this differently. when we talk about food, we typically talk about this phrase called farm to table. And I know many people have heard some variation. I've heard seed to plate. but farm to table seems to be a very common term. But farm to table is not complete in terms of where we get this data. Farm to table does not provide us with adequate information to truly put together a likelihood and severity model. What we need to then look at is the idea of not only farm to hospital, but even farm to grave or farm to funeral. If we don't acknowledge this data and how important it is, then we shouldn't be in this work. We need to make sure that we are truly collecting more than just the marketing and the profit and the sales data, that we're looking at the true impact of the food safety protocols and practices and where it sits in terms of our mission statement and our corporate philosophy on work. We have to take in consideration the consequences or of our actions or our lack of actions in terms of how this impacts public health. Now, it's very easy to say that there's some people that get sick and there's some people that die, but there's also people in the middle who are hospitalized. They may undergo dialysis, they may have to have surgeries, they may have to go through significant medical procedures, and they are discharged, but they are far from recovered. They are not discharged from the physical impact, the harm that came to them as a result of a failure in food safety. They will live with a life forever impacted, forever diminished, forever um, um, changed as a result of a failure in food safety. We have to take all this into consideration. So, I want to introduce what I'm going to call some anchor points in some ways that I think that we need to think about our role as leaders in food safety. Our anchor point number one is that responsibility cannot be outsourced. You know, we outsource so many different things. We outsource everything from sales to transportation, distribution to sanitation sometimes. Outsourcing seems to be very convenient, but the last thing we should ever outsource is responsibility. If you are in a position of responsibility, no element of that responsibility can either be simply given to someone else or relinquished from you as the person who holds that responsibility. There's no such thing as a day off when it comes to your responsibility for that company, for that product, for the food safety of that company. You cannot outsource responsibility. And when we look at the idea of that responsibility, we have to consider how wherever you are, whether you're at a restaurant or retail, whether you're involved in food transport, food processing, packaging, the farm, there are risks that may impact your product at every level, and that you still have to maintain some responsibility over that overall food safety and quality, whether we're talking about foodborne pathogens or food allergens, quite honestly. At the farm, we have pathogens from soil, irrigation water, animal contact, even human worker contact. There's great opportunities for data collection, though. You know, water testing, that's very proactive. Outbreak tracebacks, that's very reactive. But also the use of smart sensors and irrigation using real-time data collection to always be measuring what is going on in terms of any types of chance for contamination across the supply chain. When we look at processing and manufacturing, cross-contamination, sanitation lapses, temperature control failures, these are some of the top ways in which there's contamination issues. But again, with data, looking at proactively setting up HACCP logs, environmental swabs after incidents, and even automated temperature alarms for that more kind of real-time data collection. With transportation and storage, we have cold chain breaches and mixed loads, but we can also be using GPS-linked temperature tracking and other measures as real-time dosimetry, very much like the dosimetry I used on my submarine. At retail and food services, restaurant, etc., storage, mishandling, employee hygiene lapses, these are some of the common issues for contamination. But if we look at those data points, again, proactively, we can be collecting regular inspections. Reactively, well, there's customer complaint logs. But then in real time, we can be looking at perhaps IoT-based temperature and sanitation monitoring. I think we must also consider the consumer, the idea of undercooking, cross-contamination at home. How do we convey on a package how to properly cook and prepare that food such that it is extending the effort, all the efforts in food safety, all the way, not to the point of sale, but even to the plate for our consumers? I think it's important then to make sure we have public health reporting systems as essential part of our feedback loop. Again, that idea of extending beyond farm to fork and looking at public health data, whether it's from the hospital or from funerals. We must be willing to acknowledge that even outside of the confines of our company, when we look at what took place before or after our company in terms of that journey of the food from the farm to the table, to the consumer, that there is opportunity for failures that can result in recalls or outbreaks all along that journey, all along that chain, if you will. We all play an important role in that. Even if it's not our fault, our brand name may still be on there, or our name as the farm, or our name as a company involved in that is still attached to that product. And we have to make sure that we are not the weakest link, or we are not someone who is ignoring that there's a weakest link in the chain, and that we are now dealing with that. So we have to take all these things into consideration, the entire responsibility, the entire journey of food, where that plays. And, again, there's the public health impact, but there's also the economic impact. Several opportunities, several attempts to determine the costs have taken place, the cost of an outbreak, the cost of a recall. And of course, this is going to change based on so many factors: the size of the company, the size of the recall, the nature of the recall, things of that nature, the size of the outbreak, the consequences of the outbreak, things of those nature. But one piece of data that I have gained over the years has rung pretty much true. There's the cost of compliance. And yes, I recognize and will openly, freely admit that there is a cost of compliance. No one's saying that it costs nothing to comply with regulatory policies and laws, whether it's at the state or the federal or international standards. But we must consider the fact that there is a cost of non-compliance. And much of the data that's taken that's been taken and collected and evaluated has shown that the cost of compliance versus the cost of non-compliance across many sectors has ultimately amounted to this. The cost of non-compliance is approximately 17 times more expensive than the cost of compliance. You can look at it a different way. Being proactive ultimately is much more economically sound than being reactive. If we put efforts into food safety only after there are headlines, after there are recalls, outbreaks declared, after people have been harmed, it's always going to cost far more greater than if we had invested money into preventing it in the first place. Every single time. There was a recent outbreak last year with E. coli contaminated onions and a major global fast food chain. And ultimately, I'm pretty sure it's been determined now. My belief is that it's not actually their original fault. It started with the farm they got the onions from. However, they still had a responsibility to do their own independent testing. And yes, that would have cost money to do their own independent testing, but it would have been far less expensive than what they're investing into it now as a result of this outbreak. People died. Their reputation's been tarnished. They initially came out and said that they're going to pump $100 million into the specific franchisees that were impacted by this, and that doesn't even include, you know, lawsuits, wrongful death, settlements, anything like that, fines and fees, who knows what. But we know that it would have cost far less than $100 million to have done the testing to proactively identify and prevent that contamination, that contaminated food from getting onto the into the hands of their consumers. So the nature of this conversation, looking at this idea of farm to table being shifted to farm to hospital, the term farm to table has been it's polished into a marketing jewel, conjuring visions of wholesome, unbroken chains between the soil and the plate. But it is, in truth, a dangerously narrow lens through which to view food safety. By stopping the narrative at the diner's fork, it erases the most revealing chapters of the story. What happens after consumption? Likelihood and severity models in food safety cannot be fully trusted when they exclude the sobering trail of data held by emergency departments, epidemiologists, and even funeral homes. Illnesses that never trigger a product recall, outbreaks misattributed to stomach flu, and fatalities whose origins are quietly buried in death certificates. All of these live outside the farm to table fairy tale. Without integrating these downstream signals, our risk assessments are more public relations than public health. They're built on a myth that ends with the meal rather than the human consequences. I thought this is so important. I don't normally put a lot of words on a screen, but I wanted to leave this with folks in terms of my philosophy on why farm to table is such an inappropriate, narrow view of the data that we must be collecting in terms of justifying, cultivating, validating our food safety efforts in the food industry. Whatever your job is, wherever your company lies within that farm to food to consumer and beyond journey, I think it's important to understand that, again, farm to table is quite outdated. We need to make sure that we have a variety of forms of data, not only the real time, not only the accurate slash complete, and not only data that holds us accountable, but is reactive. We need to make sure that we, as leaders, understand and are able to use any and all forms of data and to act upon this data. The consequences of which are lawsuits, recalls, obituaries, and families who live with the chair forever empty at their family table. None of these can technically be undone or have a do-over. We need to make sure we're as accurate as possible. So let's look at anchor point number 2, and I'm going to get into a couple stories here. Anchor point number 2 is silence is the first failure. I can tell many stories, but one of the stories I love to tell the most is a conversation I had with an inspector who was at a large manufacturing plant and was in a walk-in freezer unit, very similar to this. And this person observed some gouges about 8 to 10 inches above the floor on the wall, and you can see them here. These black marks down near the floor here on the wall, and inquired what was going on there. And the leaders of the company sent someone out to figure out what was going on. And an engineer came back and goes, "I found out what's going on. Essentially, these were gouges from when lifts, not necessarily forklifts like this, but some type of a food pallet lift vessel vehicle, I mean, was slipping on condensation, turned into ice on the floor, and running into the wall. And so the company's CEO said, "Well, let's spare no expense and let's get um, the best quality non-slip wheels there were for these hand trucks, these lifting vehicles." And so they sent the head of maintenance and engineering out to do that. And luckily, this person had been a part of their community. I'm sorry, their company's employee-led food safety committee, and learned about a piece of information that became important here, and came back to the CEO and said, "We can't get the top rated." And of course, the CEO is like, "Why?" Well, it turns out that the top rated non-slip wheel is made with walnut shells. Walnut shells are used in the rubber of the wheel to make it non-slip. And so if they had used that, they would have violated the fact that this was a certified nut allergen free facility. And that technically, by using the walnut shells, they would have had to figure out, if not just forego that nut allergen free certification. So imagine if that guy hadn't said anything. Imagine how many times that would have caused problems down the road. And this happens quite often. I've literally been in large conferences where I've asked people who work in food safety if they've ever seen something at a restaurant, like, in their off hours and their personal time with their family, they see something that was not up to standard, or was not, was not safe in terms of food safety. And then I asked them how many people actually said something. It's amazing how many people indicated that they had not said anything, because they would have been considered to be rude, or it would have been inappropriate for them to say something. When we stay silent, that becomes problematic. We need to make sure that we have the strength and the will, and quite honestly, we cultivate an environment where we can say what is wrong and what needs to be resolved. Similarly, let's look at anchor point number 3. Drills, inspections, and instincts must be based on reality, not on comfort. We need to make sure we're recall ready. We need to make sure that we do mock recalls, or we do drills, practice recalls, if you will. And these cannot be based on convenience. These cannot be, done when it's convenient, or stopped when it's convenient, or only include the people that are convenient, because that's never how the real situation plays out. We need to make sure that when we are preparing for making sure that our SOPs, making sure that our teams, that our individual, our training, and then our mock recalls are there to make sure that we're running as smoothly as possible. All of these have to be based on reality. If anything, if you are not finding areas for improvement when you're doing these recalls, you're not doing them enough, or you're not doing them accurately enough. We need to make sure that these, again, they're based on reality, not on comfort or convenience. I saw this play out once, of all things, with something that turned out to be extremely costly, and it started with an olive. I sat down with the CEO of a company who was talking with me about how he ended up firing an employee. There was a shipment of olives that were supposed to be completely processed and were supposed to be free of the pits, but they were finding uh, particulates, or particles of the olive pits in the mix. And a production plant manager had an opportunity to stop what was going on and to discard those olives, and to bring in and to retest another shipment of olives, uh, but ultimately decided, oh, what's the worst that could happen? And I don't want to do something that's going to ultimately cost them. I think it was determined to cost about $19,000 would have been the cost of throwing away and retesting some olives. Well, what ended up happening was the company they ultimately did the right thing and that they did a recall this food. And the CEO is so thankful that no one was harmed, or at least no one reported being harmed from this, but reported that that recall ultimately costed the company about $12 million. And when I inquired about why they fired that production manager, it wasn't about the cost. It was about the fact that the company no longer had confidence in that person to make the right decision. And the fact that the person made the decision to uh, act upon the idea of what's the worst that could happen, probably nothing, as opposed to making a decision based on the worst possible case scenario. It wasn't about the fact that they could have saved the company a lot of money by doing the right thing in the first place. It was about the fact that there was no longer that trust that he had there with that employee. And again, the idea of being proactive, yes, it would have come with a cost. In this case, about $19,000. But being reactive, that recall cost $12 million. Again, the idea of there's a cost to compliance, but non-compliance is always going to cost far more. So anchor point number 4, legacy is defined by what you refuse to normalize. Obviously, there's the legacy of the person who made the decision to not take away those olives, but think about the legacy of that CEO of the company, right? They refuse to normalize the idea of acting based on well, what's the worst that could happen, and going with what's convenient, right? The idea of taking a stand and saying we must operate under the assumption that the actual worst case scenario will play out. And that even though they could have given that guy a slap on the hand, what message would that have sent to the other employees? That you can literally make a horrible decision at a company and then just continue on like business is normal, like you get a mulligan, which is the idea of getting a do-over, if you will. So legacy is defined by what you refuse to normalize, right? It's defined by what you try to prevent rather than what you try to deal with after the fact as crisis management because you refuse to prevent it in the first place. Silence is not neutral. Silence is a choice. Leadership is a choice too. It's your choice to act in terms of whether you're going to be the leader that makes a decision that may cost money, and hope that it doesn't explode in front of your face, or if you wait until you have no other choice but to react to it. One of the things that I've heard so many times over the last 3 decades, some 32 years of my life now, it's important to explain how I often talk with families. I'll get emails, I'll get text messages, sometimes phone calls from families whose children are either in the hospital or these are parents who recently buried a child due to failures in food safety, due to a foodborne pathogen. And the amount of times that I hear this phrase, how can this still be happening? Is one very consistent element across all of the communications I've ever had with people. Uh, I remember talking with the family, and I still know this family. Their child got sick from E. coli due to ground beef sold at a store, and the store had been given a letter. They received a letter from the federal government saying that there was contaminated product, and they requested the store take it off their shelves. But ultimately, the store manager said, "Well, we don't have enough indication. I don't have anyone complaining about it. I don't think we need to take it off the shelves." And they continue to sell it for days and days and weeks until literally this little boy got sick and ultimately died from E. coli. And the lawyers came back to that store and said that it is your fault if you had not if you had taken these off of your shelf, this could have been prevented. And this was only 11 years ago. There's another family. I actually met up with them, and this mom, Her daughter, when she was 2, got sick from contaminated raw milk. And why people are still drinking raw milk, I don't know. We just literally days ago here in the United States in Florida, there's an issue with raw milk again, people becoming sick, usually young children, usually those with compromised immune system. Now, this little girl didn't die. She was very, very ill. Dialysis, she had a stroke, ultimately is dealing with cognitive and physical delay. This child will never speak, will never walk on her own, will never have a normal childhood, will never live on her own, will never go to school, will never have so many of the experiences we have because she is stuck with this kind of cognitive and physical delay, that being of a 2-year-old. And this mother confided in me about how much guilt she feels. And it's not the guilt you would necessarily assume. She feels guilty in that so many people come up to her and say, "Oh, she should be so thankful that her daughter lived," and yet to her, this is not the daughter that she knew before then. It's as if this is a different daughter, and she's living with so many levels of guilt in terms of this illness. It's important for us to look at the idea of anchor point number 5, then, that survival is not the same as recovery. We always talk about things in terms of people who, they got sick and they're okay now, and there's people who die. And we use statistics, we look at this kind of thing, but we don't typically focus on the fact that there are much more. There's a very large percentage of those people who they don't die, and they did get sick, and they did, they were discharged from the hospital, but they were never discharged from the harm that was brought upon them because of this failure in food safety. They will live with maybe impacted kidney function. I've seen early onset arthritis, vocal cord damage. I've seen concerns in terms of their reproductive health, the idea of physical and cognitive delay. There are so many medical conditions that people will live with, or their quality of life is forever impacted because of this. And it's important for us to understand that other category of harm that people receive. Not everyone is a quote unquote healthy adult who, for them, it was just a stomach flu. We also have to consider the fact that I talk about the idea of public health data. It's important to understand our public health stakeholders. Here's a 4-year-old girl who was dealing with bloody diarrhea, and her father packs her up in their car to take her to be seen by an urgent care facility. Along the way, he ends up calling his brother and starts rattling off some of his daughter's symptoms to his brother to see if he can give him any insight. And I think he just on the computer look up things. The brother on the phone says, "Hey, you need to ask them to test for E. coli." And ultimately, father gets the daughter to be seen by a doctor. The doctor sends her home saying, keep her hydrated and she should see her doctor within a week. This 4-year-old girl never saw her family doctor within a week because she was dead within 36 hours because she had already been within significant stages of renal failure. The doctor never tested for E. coli. The doctor never really checked out her renal status. And ultimately, after this child's death, the investigation found that the word E. coli in question mark was on the side margin of some of the paperwork there from that doctor's office. But the doctor did not see fit to test a 4-year-old girl with bloody diarrhea for a foodborne pathogen. This one still blows my mind in terms of the idea that it's not just the awareness and the data collection and the actions of those within the food industry. It's also those who work in public health who play a role. And perhaps this little girl would be alive today if everyone had connected all this data together. So yeah, the fact that the word E. coli in question mark was literally found on the paper marks was just a slap in the face in terms of this family dealing with its consequences. And I know far too well the idea of dealing with these consequences. This is Riley, and Riley, at 16 months of age, became sick with E. coli during the infamous landmark Jack in the Box E. coli outbreak in 1993. He never ate the hamburger that made him sick. He got sick from another child in his daycare class. And I'll tell you this, I will never forget sitting on his hospital bed holding him when he looked at an IV bag and confused it for a bottle, and he asked for his baba. They ended up being the last words that I heard my son Riley say. He didn't really want a bottle as much as he wanted normalcy. He wanted comfort and he wanted to be back home. I'll never forget seeing him being loaded onto a helicopter to be flown 90 minutes away to a better hospital where he could be treated for and looked after. I'll never forget seeing him after he had surgery where they removed the majority of his colon that was damaged as a result of this pathogen. And I will never forget seeing him again being carried in the world's smallest coffin at his funeral. One of the things I've learned from this is that failures don't often begin with pathogens, they begin with blind spots. And I believe that one of the reasons for blind spots is that we don't often have a true sense of the true burden of disease. We don't often talk with families who have been through this, with victims who've been through this, and understand what it's like to truly be sick or to lose a family member due to a failure in food safety. And perhaps if we eroded some of these blind spots, we would be looking for better accuracy, better completeness, more real-time data, and we would be looking to act faster with this data that we collected. I'd like to talk about the evolution of food safety in regards to 1993 with the Jack in the Box E. coli outbreak. You know, well before 1993, it's not like we never talked about food safety, but we very rarely did. We became aware with it with the 1906 novel The Jungle by Upton Sinclair, but we really didn't talk about food safety again as a society until 1993 with the Jack in the Box E. coli outbreak. We realized how disjointed and how reactive our oversight was. And I just realized I spelled oversight wrong. Sorry about that. Um, uh, the hazard analysis and critical control points. Well, we saw this with our space industry and even with our submarines, but we didn't necessarily see it as being mandated for high risk foods. So after the 1993 Jack in the Box E. coli outbreak, now all of a sudden we had awareness of E. coli, USDA declared E. coli an illegal adulterant in meat, and now we were looking at more science-based inspections, more proactive efforts, and new real-time measures in terms of food safety. Some of the reforms that even came out of that was the USDA mandating HACCP for meat and poultry and expanded outbreak and surveillance. But we had to realize that in the United States, at least, it was not for many years later until we finally saw the FDA basically outside of meat and poultry, which is where the most of the conversation for a good 10, 15 years about food safety was centered. We didn't see it until about, again, 10, 15 years later, that now there was a shift to focus on FDA regulated foods, the produce, the commercially packaged good, the ready to eat foods, anything that was not meat and poultry. We saw a shift in terms of an increase in foods regulated by the Food and Drug Administration with outbreaks and recalls and people being harmed. Now with the Food Safety Modernization Act, and since then, not only do we see these policies around prevention and data-driven action, but even dealing with the integration of technology. I wrote about this a great deal in my first two books, Food Safety Past, Present, and Prediction, as well as Building the Future of Food Safety Technology. And some very specific strategies I want to focus on before we end and kind of go to our Q&A here is the idea of industry level strategies, mandatory data transparency, supplier verification systems tied to both proactive and real-time alerts, the idea of retail food service strategies, continuous continuous staff training informed by incident data, not just incidents within that company, but within the sector, I believe. We need real-time kitchen monitoring systems. Consumer level action, the idea of public education campaigns that make data accessible and actionable. We need to look at our technology in food safety, whether it's blockchain for traceability, rapid pathogen testing, AI outbreak prediction kind of software. And I'll hint on the idea of rapid pathogen tests, the idea of the accuracy, but also the timeliness of those tests can result in significant, not only public health impact, but even economic impact for a company. I mentioned the idea of collaboration across sectors, industry, government, academia partnerships. The entire farm to table and beyond sector needs to be working together in terms of providing leadership and responsibility over food safety. And even that idea of infrastructure across sectors, industry, government, academia partnerships to ensure all forms of data are collected, shared, and acted upon. So a quick review of those anchor points. Responsibility cannot be outsourced. Silence is the first failure. Drills, inspections, and instincts must be based on reality, not on comfort or convenience. Legacy is defined by what you refuse to normalize, and survival is not the same as recovery. And with that, we have a good 10 or so minutes for Q&A, and I'm happy to support that and take people's questions.
Thank you so much, Darin. It was really partly heartbreaking, very sensitive, and also super fulfilled topic. I was really like somehow even frozen, like without any idea how to comment on this. So, guys, please give as much appreciation as you can with the reaction to our marvelous speaker today. So I'm just looking forward to see more hearts, claps, thumbs ups, and all possible reactions you can share. So, and I saw already some questions, but if I'm not if you don't mind, I will start first with a very like generic one. But if we kind of summarize from the farm to the hospital, where do you see the highest risk points for foodborne contamination?
Well, it depends on where you're looking at it. If we only talk about things in terms of the average healthy adult, that becomes problematic. But if we start looking at the idea of we want to make food that is intended to be safe for the most vulnerable victims, the very young, the elderly, those who are pregnant, those who have compromised immune systems, if we make it safe for them, then we will be making it safe for those healthy average adults, if you will. But if we only look at the average healthy adults, then we're kind of excluding those who are, again, most vulnerable to those pathogens. So if we're creating likelihood and severity models, those likelihood and severity models should be anchored, if you will, to the most vulnerable victims. So for instance, when I look at listeria outbreaks, um, I almost always will see that there is, especially if it's like associated with deli meats, sliced meats, cheeses. I almost always find that someone, you have your statistics who got sick, their age ranges, but there's almost always an indication of a stillbirth or a miscarriage. We have to consider that. That plays a role in terms of not only education of consumers, but also it should play a role in terms of what if those who have a responsibility for food safety have no idea that this impacts people this way. They just think, oh, someone has an excuse to take the day off from work because they got a stomach bug, a stomach flu. Um, you know, Understanding that this data, even if it's not from our company, right? But our company
Yeah,
sells this product, and in this sector of food retail, we can see that other companies have had these outbreaks, have had these recalls, and yet it had nothing to do with us. But we have to look at their data too, because their
yeah,
data easily could be our data. We have to look at
yeah,
the fact that if we limit our data to our own company and to the information that's convenient and to the information that excludes public health data, then we're really looking at an ideal set of numbers, not a real picture. And that has a significant impact on our procedures, on our training, on our corporate culture of food safety and overall awareness of the weight of responsibility that we have in food safety. And whew, maybe you're lucky that you've never had to deal with an outbreak or recall or a failure at your company, but you could be dealing with that tomorrow. And I hate to say it like I'm sounding pessimistic or very negative, but we need to understand that tomorrow could be a different day. And if we don't learn even from our
Yeah.
competitors that are selling the same thing or using the same equipment or whatever it is, they're partnering with the same distribution company or whatever, that this easily could be us in the next headline. So we need to look at this and realize that the better informed we are, it impacts so many different levels of our operation.
Yeah, thank you so much, Darin. Before I continue with my questions, I still want to ask questions which were written already in the chat room. So the next one is coming from Sharon Simpson. Why do you think fecal samples are not immediately done by medical staff when person is ill with diarrhea?
Mm. That is a great question, and that's one that's been asked a great deal. One thing that blows me away is that people will jump to the idea that, oh, it's like the insurance companies making, in the United States at least, it's the insurance company dictating this, the insurance company won't allow it, or the people don't have insurance. But one of the things that we've uncovered is that most doctors, they'll go through medical school, they do all this kind of stuff. They have zero training when it comes to food safety, foodborne pathogens, hemolytic uremic syndrome, that kind of a thing. I actually work with a doctor who is one of the leading pediatricians when it comes to working with foodborne illness cases. And he has told me two things that I'll never forget. One is that a doctor's role is to determine whether or not it's in the gut and to treat it if it is. It is not to determine how it got there. A doctor will never be able to determine how it got there, right? That's what public health resources are there to do. Public health agencies, public health departments, they're there to, to deploy questionnaires and to interview people and to figure out what's a common denominator and find out that it came from this restaurant or it came from that store or that product, right? But they should never be trying to figure out how it got there. And it's imperative that they determine whether or not the pathogen is there. There are some cases where doctors have literally made the situation worse because they didn't test for it. They gave so much antibiotic and gave pain medication rather than treating and trying to, take care of the pathogen that's in the patient's gut in a timely manner. If they had just been able to properly diagnose and treat the patient early, then perhaps it would have been, either a smoother road, or perhaps the patient wouldn't have died in the first place. But we have evolved in terms of our understanding of this over the last 3 decades. But it's really surprising to hear within the medical community that doctors are ill trained and ill prepared in many cases to deal with this, and they will make a diagnosis based on what's convenient, not based on getting actual data that either rules out a pathogen or identifies that the correct pathogen is actually, not the correct, but what exactly is the pathogen that's in their patient that's causing these problems.
Yeah, and the next question is actually coming from this one. We need to teach physicians to create awareness on Salmonella and E. coli. How would you suggest to do so?
That's a tough one. I worked with a group that was trying to make it a state law in Oregon that doctors were required to test patients if they were in the most vulnerable categories and presented with bloody diarrhea or other obvious symptoms of a foodborne pathogen. I think that, we as people need to, advocate for ourselves, and we need to realize that, just because someone says they're a doctor and they have a diploma on their wall and they have the fancy initials after their letter doesn't necessarily mean that they are, looking out for these things. Yesterday, I was actually talking to a friend of mine who was sick, and she was trying to, advocate for herself and research about her symptoms and suggest the doctor give a specific test to look for H. pylori in her gut. And the doctor was like, kind of like, what do you mean you're asking me to, who are you to ask me to, to test for this kind of a thing? I think that if we are better educated as consumers, we need to realize that, well, doctors are consumers too. And maybe
Yeah.
if we were all better educated as consumers about food safety, that would trickle into the idea of people that are nurses or doctors or first responders of any case, any type or whatever. They also would know more about food safety, foodborne pathogens, and the impact on consumers' bodies.
Yeah, that's definitely true. We have so many questions, Darin. So, next one is how do you see the enforcement of the food traceability rule being postponed once again when it should be already implemented?
Uh, this might be controversial, but I am who I am, and if you know who I am, you know that I don't back away from anything like this. I think it's a slap in the face of the consumer. I think that quite honestly, that decision was made to the benefit of the industry, not to the benefit of the consumer. And it is the complete antithesis of the idea of acting in the best interest of public and public health. And, delaying it is not going to make it any less expensive for companies to do this down the road. And all the work that went into getting it to that point being put on delay is just, it's not exactly as if we put the entire food system on hold or pause, right? So we're continuing to do this knowing that we could be having greater transparency, but we don't until such later time when it is, what's that word? Convenient, not for public health, but for the industry. That's how I view this.
Yeah. Thank you so much, Darin. Next question is coming from a very good friend of mine with whom we met in Amsterdam, Karen Hobbs. First of all, 100,000 compliments to you, Darin. Thank you for sharing your personal stories, and my heart goes out to you and the families of the children who suffered as a result of the foodborne outbreak. Given the existence of technologies that offer rapid testing similar to what NEMIS offer, thank you, Karen. It was not paid comment. So, how can a frontline establishment like restaurants, school, hospital, and nursing homes effectively utilize these new technologies?
Well, what amazes me is, for a long time, people talk about new technologies like it's space age, it's the technology of the future, the technology of tomorrow kind of a thing. We have it here now, right? And why would we not be using the technology that we have today that would provide us rapid data, rapid confirmation, rapid peace of mind, quite honestly, rapid confidence in terms of what we do? Why is it that, some people order from Amazon and you have immediate updates in terms of where it is. Has it been packaged? Has it been shipped? Has it been delivered? You can order. You can on your phone. You can dial up. Getting a ride on a ride share app like Lyft or Uber or whatever, and it'll tell you in real time where is this car now on its way to you. There are so many things that we've come to accept and expect in terms of rapid and real time data. Why are we not demanding this? And why are we not normalizing this as something in terms of food? It's one thing if we were living on a farm and everything we ate was, on our property. But we know that that's not the world today. We know that our food travels far more today than it ever traveled, decades ago when we were children, kind of a thing. And our food system is so much more complicated that the one thing that we could do to try to level the field in terms of making sure that consumers are as safe as possible is rapid testing, to have that confidence, to have that trust and reputation as a company in terms of the safetiness of the food that we sell to other people. I don't know why people aren't gravitating toward this more.
Yeah, but with the COVID tests, it made already minds easier to convince that something is like available and easy to use. So rapid tests are not really unknown anymore. So
Yeah,
I hope we have time for two more questions because I found it
sure.
quite interesting. So, apart from effective risk analysis, what do you think are the major or most notable blind spots at the major point in the farm to hospital chain?
Well, we saw this recently where there were companies that only like, well, once we handed this off to them, then we didn't care anymore. We didn't ask any more questions. We weren't collecting any more data. And there were significant recalls and outbreaks tied to leafy greens. And investigators went to the grocery stores, the retailers, and they couldn't tell you where the lettuce, where the leafy greens came from. And then they went to some of the likely suppliers, the farms, and they couldn't tell you where it went to. So it's like, how can you have a recall if the people on both ends didn't know, that string connecting them back to each other, where it came from or where it went? So having this better it's more than situational awareness. Again, it is responsibility. Yes, one could say, well, my responsibility ends when the product leaves the farm. Does it? Because if your farm's name is on the packaging of that, and there's something that happens way over here at the end or on the way towards the end of the journey of food, guess what? It's going to find its way back to you, if not in a court of law, at least in the court of public opinion. So whether you're saying your responsibility is to your job, or your responsibility is to your company, or your responsibility is to your consumer, your responsibility then has a much larger stretch that con- that continues on in terms of all of the stakeholders who are connected to your product. You know, it involves all the data that would be collected from farm to table and beyond, right? Now, when we start looking at that, it becomes this bigger picture in terms of this. Now, let's look at this in a different perspective, right? If these people responsible for these things are not given the tools, the power, the responsibility, and they're not, we're not hiring people with accurate or adequate degrees or experience, and we're not compensating them enough to be able to do all this kind of stuff, well, you're going to get what you pay for as a company. If you want someone to be in charge of your food safety and quality assurance, they need to be in charge of the whole range of that responsibility, not just what's convenient for the company or for the compensation level. The other thing too is that there's people above that person at the executive table that are going to be making decisions. You need to make sure that the people in charge of food safety and quality assurance have an actual place at that table and have the ability to shape decisions by the company based on what they know in terms of the food safety and quality of their products.
Yeah, thank you so much, Darin. And I swear, the last question for today. Could the daily metric, which is like disability adjusted life year metric, be a good tool to measure the real health impact when building a food risk assessment?
I'd like to say yes, but I'll add this. I have talked to companies who have literally addressed this issue, saying that while collecting a ton of data like this sounds great on paper, they don't want this data to be used against them in a lawsuit. And they will actively try to collect less and less data so that there's less and less data for them to be afraid of. And of course, this is a horrible perspective, but the fact that there are companies out there that this is their thinking, if I collect data on this, then that means I have data on this. And if I'm required by a court to, you know, uh, if this is subpoenaed from me in terms of providing this information, it can be used against me. And I don't want this to be used against me. So I'm not going to collect this data. It is sad that there are companies out there that act this way. Here's an idea. why don't you act as a leader in a way such that you have nothing to hide? You have nothing to be worried about or have, sitting on some kind of a guilty conscience in terms of what you do or do not collect, what data you do or do not collect, what data you do or do not act upon, and how capable your workforce is in terms of acting on that data. When we look at corporate social responsibility, you know what? It's not the people who get in trouble when things go wrong. It is the subset of that. The people who got in trouble because something went wrong and they failed to act as leaders to do something to change, to mitigate, to rectify the situation. And when economics gets in the way of you doing that, again, maybe you need to kind of reconsider what is convenient and what is not for you, and what is the legacy that you want to have for your life, your career, whether as an individual or as a company. So, unfortunately, if everyone acted the way they should be acting as leaders, we wouldn't be having these kind of situations. And I hate to sound like I'm like some conspiracy kind of guy, but it's crazy when you hear that this person's going to jail, this person's been fined, this person's punished, but and why? Oh, because they prioritize profit over doing the right thing. Because doing the right thing wasn't convenient to them in terms of their profits. Greed and convenience convened to make a leader ineffective in terms of protecting their consumers. And if this was a one time kind of thing, I wouldn't be talking about it. Unfortunately, we know that there are far too many examples of incidents, outbreaks, and recalls out there where when you really kind of complete your investigation, this is what they found out. Company had the information, or they could have been looking for the information, but they decided not to get that or not to act upon it. And we as consumers ultimately pay the price every single time.
Thank you so much, Darin. And I'm exactly the person who would listen to you hours and hours and hours and hours long. I'm looking forward to see your appreciation to our brilliant speaker today, guys. Please shoot on claps, hearts, as much appreciation as you can give straight away to, in my point of view, one of the best speakers of ours and a very good friend of ours as well. And just a small announcement at the end that September is gonna be like a super highly educational month for NEMIS Academy, because we will be able to meet offline with those who are in Chicago area in Rosemont, because they're gonna be an offline workshop with a friend Yanis. Don't miss the opportunity. And if you are our Academy listener, drop me a message. I will give you a very good discount. And for those who are in Europe, more convenient is to attend our HACCP Level 3 BRCGS certified course with amazing trainers, Sonia, Andre, but it's more convenient for those who are in European time zone, specifically UK and Europe. And for those others, just follow our newsletter, and looking forward to see you at our next sessions. Have a lovely day and have a lovely evening. Bye bye.